Good evening, everyone. Today I am going to explain about the measurement of waist and hips. क्वेश्चन पिछली बार की तरह हमेशा की तरह सेम हो सकते हैं. What is anthropometry? Define what is anthropometry and demonstrate the steps of waist and hip circumference measurement or any other measurement which is being asked. And finally, OSPE स्टेशन चेकलिस्ट जिसमें एग्जामिनर चेक करेगा कि आपने क्या-क्या स्टेप्स और कैसे परफॉर्म करे. So what is anthropometry? It is the study of measurement of the human body in terms of dimension of bone, muscle and adipose tissue. Waist circumference is a measure of central or abdominal obesity, or you can say fat distribution assessment. It can also be used to diagnose obesity. According to WHO, in case of men, it is more than 94 centimeter, and in case of women, it is more than 80 centimeter. Then it is associated with increased risk of cardiovascular disease and metabolic complication. While the risk is significantly high if in case of women, it is more than 88 centimeter, and in case of men, it is more than 102 centimeter. ASEAN cutoff is slightly lower than the WHO cutoff, where it is more than 90 centimeter for male and more than 80 centimeter for female. This is the classification of waist-hip ratio. If we divide waist circumference with the hip circumference, then we will get the waist-hip ratio. It is most of the time less than or equal to 1. If a person is having low health risk, in case of women, it is measuring from 0.8 or less than 0.8. And for men, it is 0.95 or lower than that. If the person is having moderate health risk, then it is measuring 0.81 to 0.85. And for men, it is 0.96 to 1. For high health risk, in case of women, it is having equal to or more than 0.86, or in case of men, equal to or more than 1. These are certain Indian cutoff indicators for male and female. You can go through these numbers and mug it up because these numbers are mostly and commonly asked in PG examination, entrance examination. There are certain general principle for the students. Students should introduce themselves and explain the procedure to the patient or subject. They should obtain consent, ensure privacy and comfort of the patient. Always use a calibrated equipment with a standardized technique, and they should accurately measure all the measurements to the nearest of 1 millimeter. First, I will talk about waist circumference measurement. According to different guidelines, there are different criteria or different locations at which waist circumference can be measured. According to WHO, it should be measured at the midpoint between the lowest margin of the last palpebral rib and top of the iliac crest. While according to N. Haynes study, it is measured at the level of top of the iliac crest. According to Mesa's study, umbilicus is the point at which it should be measured on the axis of mid-axillary line. And the student should put the non-stretchable tape around the point at the level of umbilicus on the mid-axillary line, which is the most recommended side according to WHO. These are various steps. Subject should stand with arm at the side, feet positioned close together, and weight evenly distributed across the feet so that the body is uniformly distributed, and the student should stand behind the subject and palpate the hip area for the right iliac crest and mark a horizontal line at the high point of the iliac crest, and then cross the line to indicate the mid-axillary line of the body. Then he should stand on the right side and place a non-stretchable measuring tape around the trunk in a horizontal position or just parallel to the ground at the level marked on the right side of the trunk. He should make sure that tape is parallel and it is snugly fit but does not compress the skin of the subject. The measurement is made at minimal respiration or at the end of a gentle expiration. to the nearest of 0.1 centimeter or 1 millimeter. For hip circumference, it is a measurement at the largest or widest circumference around the buttock over the greater trochanter. The student should put non-stretchable tape snugly on the standing subject with the tape parallel to the. These are the steps of the measurement of hip circumference. The subject should stand erect with the feet together and weight evenly distributed on the feet. The subject should stand on the right. The student should stand on the right side of the subject and place the measuring tape around the buttock at the maximum extension of the buttock as shown in the figure marked by arrow. Then adjust the side of the tape and check the front and side so that the plane of tape is horizontal. The zero end of tape is held under the measurement value. The tape is held snugly but not too tight, and measurement should be done from right side at the end of gentle expiration or at the end of gentle respiration. And students should measure it twice. If they are within 1 centimeter of one another, the average should be calculated for the. Finally, the examiner will check how the student performed the procedure. He will check whether the student have maintained the patient comfort and obtained consent from the patient, whether the student was able to describe and demonstrate the equipment, personal preparation, and correct measurement technique like positioning of the patient, whether the student have recorded and interpreted the finding accordingly, and whether the student is able to identify the importance and associated indication and explain the clinical significance of performing the measurement. What is the purpose of this anthropometric measurement? This measurement helps us to assess growth and body fat distribution, diagnose obesity and related health conditions, as I have told earlier in first or second slide, such as hypertension, elevated blood lipid profile, type 2 diabetes, and cardiovascular disease. It also helps in cross-sectional analysis of the relationship between obesity and risk of disease, and it will aid in research and public health surveillance. It will also help in maintaining a cohort study if we follow the same cohort and do these measurements again and again at a certain point of time of interval. Thank you for listening. These are certain links through which, if you want, you can go through these for further reading. Thank you.